So good morning, good afternoon for those who have joined us already. Of course, we will wait for a little while now and till more people will join. We have about 60 people registered, many from, of course, the ISSA network, but also many that are whose organizations are not part of the ISSA network, but are interested in our 2-day session. So we have about 17 members who joined, and we'll just have a couple of minutes to wait for our colleague Teresa Moreno to accept all those who are in the waiting room. Okay, we have about 17 now, so we hope that more people will be joining. Okay. We are still at about 17 people who joined. So perhaps we will wait for another minute, and then we will actually start the session in earnest. Yes, some more are coming online. Okay, so maybe we can start, because the first part is really introduction, and so welcome everybody, and good morning and good afternoon, depending on where you are, to our session on early childhood education and care during the pandemic. This is a session that is organized by ISSA, and it's within the framework of the ISSA Connects for Learning sessions, and this is our third and last session. We started on Tuesday presenting a report on process quality on the ECD, and yesterday ECEC, and yesterday our colleagues from Hungary had a session on resilience, and this is our session on how the sector fared in the pandemic. And it is a report that was initiated by a research network that is called NESET, and it's a report on the lessons learned and implications for policy and practice for those working in the sector. The research actually took place in 2020. and it reflects the situation between March and December 2020. And there were actually 5 countries invited, or regions within countries invited to participate in the report. And Nima Shamat, who is from VBGK in Belgium, will actually present the findings. And she was, together with her colleagues at VBGK, she was the author of the comprehensive report, and that was based on 5 country reports. And there was Croatia and Sanja Brajkovic, who many of you know, participated to the report. And from Sweden, there was Ingrid Engdahl. From Belgium, for Flanders, there was Lisbeth Lambert. From Italy, there was Ariana Lazzari. And for Germany, and more particular for Berlin, it was myself. Yeah, so I'm Henriette Heimgartner. I'm the ISSA president since 2020, and I'm really very delighted to lead you through the session. I will do the introduction, and then, as I said, Nima will present the report. And we welcome also Victoria Rauch, who will actually give some examples from Croatia, because Sanja couldn't attend the session. And I will chip in with some examples from Berlin during the presentation. Okay, this session will be recorded, and it will be made available actually on the ISSA website, on social media, and also including YouTube. And we have, like in all our sessions, we have some ground rules. Let's be present. I mean, let's be focused and be really on the screen. And please turn off your notifications or your ringtones and your mobile phones, so that we are not disturbed. So your mic is on mute, and later on, when we have a discussion, you raise your hands, and you raise your hands through the device that there is on Zoom, and then the host will actually unmute you. And keep your contributions short, keep them concise, make them to the point. And let's be human, meaning don't turn off your screen, be really present, be also patient if somebody speaks maybe for a little bit longer. And we invite you to really also use the chat function during the presentation already. That Nima does, and we will pick up on your comments and on your questions then later on in the discussion. And as I said, the session will be recorded. So I think now we are on to a little Mentimeter. Here you have the information of how you can join the Mentimeter, because what we would like you to ask is, what is your affiliation? So where do you work? And this will come up in a minute after you have joined the Mentimeter with the combination of numbers, exactly. And so the Mentimeter, we wanted to make it really relevant also for your workplace, for the context in which you work. We ask you to see, and you can have multiple answers, of course, because many of us are engaged in multiple ways within the sector. Where are you working? Where do you see yourself? Where is your main part of work? And quite interesting is actually that we have many people that are working as trainers, as coaches, maybe also as pedagogic coordinators. This is all subsumed under this a yellow bar trainer. We have quite a number of researchers and also of other staff, because also in the report and in the presentation, you will see how important it is to actually network with other professions within the field, with health staff, with social workers, with workers in extension services. Interesting, not so many ECEC staff, so those who as practitioners work directly with children. And what of course is very deplorable, that we have actually none here in the audience that says, you know, they are also part of the decision making of the governance areas. So also quite a statement. So thank you all very much for this, and so we'll keep this also in mind while we do our presentation. And I hand over now to Nima, and Nima will give us the gist of the report, and Nima has prepared a PowerPoint for this. So over to you, Nima.
Yes, thank you, Henrietta. So as Henrietta explained, I'm going to give some insights on the main results of the analysis that we did on this report, Governing Quality ECEC in a Global Crisis, Lessons Learned from the COVID-19 Pandemic. And once in a while, I will give the floor again to Victoria and Henrietta for some specific examples from their countries. We will not give all the results. It's a very, let's say, big report that we prepared, so you can definitely read it all. But here we chose to focus on some specific themes. And after, I will explain you later, but after each theme, we would like you to already put some questions in the chat if you have it. We will not answer at that moment, we will answer at the end, but yeah, just so that we make sure that we don't lose your questions. So just to give you the framework, let's say, the aim of this study was to examine, as Henrietta said, selected EU member states, specifically two countries, Sweden and Croatia, and 3 regions, Flanders in Belgium, Berlin in Germany, and Emilia-Romagna in Italy, and to see how they have dealt with and governed the COVID-19 crisis in the first year of the pandemic. So this is until December 2020. In order to ensure quality ECEC for children and families. Why we chose these 5 countries, regions? Because we wanted a geographically balanced sample. We wanted a mix of split and integrated systems. So Sweden, Berlin, Croatia integrated, and Flanders in Belgium and Emilia-Romagna in Italy is, well, Emilia-Romagna in Italy is in a transition phase because it is actually integrated, but in practice, it still has to overcome several steps to be really integrated. And Flanders in Belgium is a split system, where, so with split, I mean that the 0 to 3 and the 3 to 6 sector are separated and managed by also different ministries, which has several consequences on practice. And integrated, there you have 0 to 6 integrated system. And then another criteria that we followed was the responses to the pandemic. So how the countries responded to the pandemic. And you can see, for example, in Italy, we had, especially because the numbers at the beginning were very high, a very different response than, for example, in Sweden. So we wanted to see how these responses, what kind of effects this had on children and families and on the use of ECEC. What we did was using the European Quality Framework on ECEC as a lens to explore these specific areas, the accessibility, the workforce, the curriculum, then the area of monitoring and evaluation, and finance and governance. And the ones that you see in blue are the ones that we are going to analyze now with you. So we decided, we made a kind of selection, not because the rest is not important, but because otherwise it was a bit too much. And maybe for this specific session, we thought accessibility, workforce, and how to deal with finance and governance can be particularly interesting. If you then have other questions about also the other areas, we can of course respond. So what are the main results with a focus on these three areas? First of all, we have to say that in all the European member states except Sweden and Finland, ECEC centers have partially been closed since mid-March 2020, and then they gradually, according to the country, reopened since May 2020. And what we also wanted to see was what are the rationales behind this closing and reopening decisions, how and why they reopened in certain countries and not in others, and why, and how, I mean, with which reason. In general, what we can see is that the very young children and families were initially not really always addressed in policy debates or documents compared to older children. In Sweden, we already see it's an exception. They start really from the children's rights perspective. And from there on, that's why in Sweden, actually, they never closed. Which doesn't mean that there are no tensions also in this decision. But the children's rights perspective was from the beginning the main rationale, let's say, for the policy decision makers. But we also see that the public health perspective initially was dominant in most countries, but gradually we started seeing variations, meaning that progressively this health concern has been combined with other perspectives related with children's rights and protection, education, social inclusion, family support, work-family reconciliation. So we see a change in the months, let's say. In the second pandemic wave, some countries, regions like Croatia, Germany, and Belgium, even started to become more aware of the importance of ECEC for children and families. So we see that in some cases, the crisis becomes a kind of turning point to actually revalue ECEC, but within a process, let's say. And here I would just give quickly the floor to Henrietta to give a specific example about Germany.
Yeah, thank you, Nima. Yeah, I mean, also in Germany in the beginning, you know, the centers were closed, but this was for 2 weeks maybe only. And then the authorities started to define what are essential workers within the society. And so healthcare staff, of course, was considered essential workers. And the children of those groups, professional groups, coined essential workers, they were given access to the ECEC centers. And this actually slowly started, but then actually it went on to be by June, it was almost like 40%, 50% of children that were again attending the center. The crisis was really also in Germany felt as a turning point because everybody became aware how essential actually ECEC services are, and not only for families, so that the parents can participate in the workforce, but for the children themselves, so that they need their peers, they need to have their well, their regular daily lives, and their daily lives are the ECEC centers are part of their daily lives. And this was made really very, very clear that our societies actually can no longer function without a good and well-organized and quality ECEC service. And it became so much clear when the second wave in Germany, the second wave started by October, November 2020, that all policymakers who went before the microphones of journalists, they said, you know, our priority is to keep ECEC and school open as long as possible, because this is really an essential service for the children and their families. So there was much more recognition and appreciation for the whole sector within the considerations of the policymakers. So over to Nima again.
Okay, thank you very much, Henrietta, for this insight. And I will also ask Victoria to do the same for Croatia, because in Croatia, let's say the rationales behind the decisions of reopening raised some concerns about quality. So please, Victoria.
Thank you, Nima. Well, the case in Croatia was that the approach was first population approach, and then it became more targeted, as in the case of Germany. So in the beginning, only emergency childcare was enabled, and then throughout the pandemics, the ECEC service was available for the children of the single parents, of those parents who had to work, of the parents who were both working or were frontline workers. But so, yeah, there has been an increased awareness of the ECEC, but I'm afraid that at the policy level, it was mostly economic based. So the rationale behind the reopening was that the children are not the motor for the virus, for spreading the infection, and actually the main reason for actually opening and leaving the ECEC settings open was supporting a family so that then they could contribute to the country's economy, which in comparison to other countries is less child focused, less focused on child education and on child protection, which unfortunately I believe left a toll on the children coming from vulnerable backgrounds. So that's something that I would like to emphasize for Croatia. I believe that the families recognized the value for the children, but at the policy level, I think that in comparison to other countries, the rationale was mostly economy based, which actually is no wonder, because we're talking about a less stable economy in Croatia than in other countries. So that's something that I wanted to point out. And in the research, there has also been evident that implementing the curricula was a lot more different than actually it was before, and that the process quality has been hindered.
Okay, thank you very much, Victoria. So this is to say that it's not really about opening or closing, but what is important is to see why you open and close. And also what we point out in this report is the balance that we should try to have between the economic, the social, and the educational functions of ECEC. So that's interesting to see how each country deals with these factors and which relevance they have. The three of them are important. It's just an aim to put them together, let's say, and to balance them. Which effects we can see on families and children from the pandemic? This is a very short summary. You can go through the report. It will be much more detailed, but just to give you an idea. In general, we can see that, and for the families and for the children, there is a combination, a tension, let's say. For the families, on one hand, there is the stress to combine work, household, and yeah, what they have to, the whole things that they have to do in the house and taking care of children, versus also an appreciation of the time that they can spend at home with children and family, and a more calm time. Here we have to say that the data are especially from families with middle-high socioeconomical status. For the children also, you see on the one hand an increase of emotional distress, so anxiety, loneliness, regressive behavior, the fear of the parents that is reflected on the children, but also enjoying the time with the family. So you see both tendencies. What is interesting as a case, let's say, is that in Sweden, which is the country that didn't close ECEC for anybody, from some research, we see that because they didn't close, ECEC, especially also in the first period, became already a resilient place for children and families, because they could immediately address these fears, anxiety, and feeling of loneliness. Of course, we see an extra pressure for societally disadvantaged families. So it is different to have a lockdown in a big house or in a small house, of course. The lack of digital device when everybody was online, the economical challenges that grow. And we see in many countries an increase of material support kits that have to be brought to the family. So an increase of poverty, basically. In this whole story, there are some voices that are not enough heard. The ones of societally disadvantaged families in general. Although in some countries there is more attention than in others, for example, in Belgium, in Flanders, and in Germany. And also children with special needs. And here I will again give the floor to Victoria for an example from Croatia.
Thank you, Nima. Yeah, besides the groups that Nima mentioned, there was another group that is really important to point out, and that is the children who were during the pandemics in the year before starting school. So actually in Croatia, we have a short compulsory preschool program 1 year before starting the school. And in some cases it is integrated in the kindergarten, but in some cases it stands alone and is organized in separate groups in kindergartens or in schools and smaller municipalities. And the thing is that those children weren't attending the compulsory program, which is mostly around 250 hours. The program was delayed. It was held in the spring and the summer, but at the same time, the schools started assessing the child's readiness for the school. So actually there was a high risk of those children to become more stigmatized, and there has been a burden and the responsibility of the children and the families to kind of achieve a good result on the assessment. But at the same time, they weren't provided with the adequate support for the learning and the child development. And also, since the children weren't able to establish contact with NGOs, with other adults, with other services in the communities, which is especially important in the year before starting school. That is also a way that the quality has been hindered, and that is also a missed opportunity for those children. And one additional thing which is important is that small ECSC settings sometimes do not have multi-professional teams employed for full-time, and the lack of the relationships with the services in the communities also enabled providing additional support to children before starting school, especially to those who were with special needs.
Okay, thank you very much, Victoria. And I will just go on to explore the areas we were talking about from the EQF. So we start with accessibility, which is connected also with what we were saying. So basically, we wanted to see, yeah, how was ECEC accessible in COVID times? So who is and is not attending ECEC? First of all, we have to say that not in all countries we have clear statistics about what happened in 2020. But we interviewed key stakeholders in each country, and they reported that the crisis might have had a more severe impact on societally disadvantaged children and families. So again, children with special needs, living in poverty. From asylum seekers or refugees, we lost track basically of a lot of these children with migration backgrounds. Why this? Because, well, there are several reasons, but these are the groups that had less access to ECEC. Because of the fear of the infection, because of financial problems, the change of work or economic situation that changes in wars. The educational situation. What is important to say is that when ECEC services have fees, of course, then some parents would not return because of the change of their economic situation. So that's something definitely to take into account. So because of these issues, in different countries and regions, policies and practices attempted to increase accessibility in several ways. And here you see some examples. In Croatia, they tried, for example, to make ECEC more affordable for families. In Berlin, also in Belgium, in Flanders, to give prior access to societally disadvantaged children in the reopening policies of ECEC. So when they reopened, they first gave place to societally disadvantaged families. The outreaching approach, for example, in Belgium, meaning that it is not just about opening ECEC, but about reaching everybody. So how do you make sure that exactly the children and families from disadvantaged background can get in? And very practically, it also means really that teachers and educators went to the houses of children and families with disadvantaged background instead of waiting for them at the ECEC center. And then another important thing is the attention paid to warm and welcoming transitions for everybody. Transitions, for example, from home to ECEC center, or from childcare to kindergarten, for the new inscribed children, but also for the children that were in the lockdown at home and they had to re-enter. So paying attention to how to welcome children and families again in ECEC in a warm way within the regulations, the health concerning health. Maybe Victoria and Henrietta, you want to say something more about the cases of Croatia and Berlin? So maybe first, I don't know, Henrietta, I see that you...
Yes,
yeah.
Yes, thank you. Thank you, Nima. Yeah, this access. Let me see, now my mic is on. Yeah, for granting access to societally disadvantaged children. Of course, this can be. I mean, in a city like Berlin, it's about 25% of all children, let's say, that belong to this group. And in many cases, as I had explained before, we had this category of essential workers, and those children were admitted with a priority in the first month. But we have a lot of evidence and stories collected of actually ECEC staff who knew when in certain families, you know, the situation was very dire because of the things that were already mentioned. There was tight housing, there were many siblings, then something very complicated in Germany that came also on board in the first 2 months. All the public playgrounds were not accessible. They were actually closed. So where do you go with children, and where can children play if the playgrounds are closed? So what then happened was that the staff itself, they practically jumped the line, they jumped the regulations, and they said, okay, we are getting into contact with such and such family, and we will have the children of those family admitted so they can come to our center, because we know they have a very difficult family situation. So that was beyond the policies that were put in place. But back to this term essential workers, this group of essential workers, this was very, very quickly actually enlarged. And one interesting phenomenon within that process was that at the beginning, it was the categories were essential workers, but what was not addressed was the specific situation of single parents who maybe also had to work and had to combine then childcare and work at their home. So very quickly there was really a public outcry, and also a lot of single parents went actually into social media and said, how should we deal with this? So relatively early in the process, actually, in one of the circulars that there was here in Berlin, all children of single parents were actually admitted. And I think that was a very, very important move to practically go away from this relatively fixed definition of essential workers to saying, okay, we also have to consider the social context in which children live, and then the children of single parents are here one of the first that we should admit when we can open the centers, when we can have increased opening of the centers. So that was, I think, a very, very important move here, and it somehow calmed down all the voices on social media around this issue. Victoria?
Thank you, Henrietta. Regarding affordability of the ECEC services in Croatia, during the lockdown, the services were either free or were cheaper than it was before the pandemics, which was shown as something beneficial for the budget of the families. And there were some additional cases where the price was cheaper for the parents. For example, if the whole group of children ended up in isolation, then the families would only pay for those days when the child attended the kindergarten. And one additional example, for example, if the child was in contact with the COVID-19 infected person, then the family could pay less because it was treated as the child's sickness. So that's something that was beneficial for the families, but unfortunately not for the workforce, but I will comment on it later.
Yeah, that's also very interesting indeed. The tension, we will see it later. The tension also with the between the needs of the children and families, the needs of the workforce. Yeah. That's also something interesting that has to be addressed. So thank you, Henriette and Victoria. And now I would I think this is the last slide for accessibility. Yes. So I would just give you 1 minute to the audience to formulate, if you have until now some specific questions or remarks or things that you want to know better. You can just put it in the chat. We will not answer now, but we will keep it for later. I just give you 1 minute to think, and then we go on with workforce. I don't know if someone is writing. Okay, I see something coming in the chat. In the meantime, I will maybe go on. So the second area that we would like to discuss with you is the one related to workforce. What happens to the workforce during the pandemic, the first part of the pandemic? The first thing that comes out from our report is that there is also here a tension between recognizing the importance of ECEC staff and overlooking them. So on the one hand, there is a recognition. In some countries, they were called heroes, or invisible or visible heroes. But also they were not always valued. So there is a tension between being recognized and not being appreciated enough. We see in split systems, for example, Belgium and Italy being in a transition modus, but we see a difference in the appreciation towards childcare staff and preschool staff, meaning that normally the childcare staff, so 0 to 3 years old, is less appreciated and they feel less valued than the preschool staff. This is, of course, something that was there also before the pandemic, but what we see is that the COVID crisis just brought up very loudly some issues that were already present before, and that's why that's one of the opportunities that this crisis gave us and is giving us, is to just take the issues that were already there and deal with them, because it's very clear, much more than in the past, that something needs to be done. What is interesting is that even in the cases in which there is recognition, very clear recognition, in Sweden, for example, the social recognition is definitely there for the staff. Also in Germany, in Berlin. This doesn't always mean that staff is listened to. So this is a bit what we were saying before, the tension with the needs of the staff. For example, in Sweden, they are definitely recognized as heroes and all, but the fact that that the main rationale behind the opening of the ECEC centers was based on children's rights, sometimes created a tension between the needs of the children and the needs of staff. So this means, for example, that staff, the ECEC staff was often afraid, which is very natural, which is very understandable. But these fears and worries were not always addressed because the main issue was responding to the rights of children and families. So there was this tension. Staff was the ECEC staff was sometimes worried and afraid, and their worries were not addressed, which also meant that this created sometimes tension with the families themselves. So the ECEC staff would, for example, think, children should stay home, and families, they are bringing children to the ECEC center, and this creates for us a worry, and the worry was not addressed, so they put it on the shoulders of the families. And they were not always involved, although they were valued, they were not always involved in the development of the guidelines, meaning, again, yeah, their worries were not taken into account. And in Germany also, there is a clear recognition, but it is interesting to see that they were actually, for example, not taken into account as essential workers. So they are recognized, but their own children couldn't attend ECEC while the ECEC staff was working. And maybe Henrietta, you want to say something more about this? At the beginning.
Yes, thank you. Yes, in fact, that is was a very astonishing finding, but that was, you know, in the first scrambling through everything and setting guidelines. So in the very first lockdown in March till about April, they were not belonging to this category, but the policymakers quickly saw, hey, this is not possible. We cannot ask them to come to work, and then what happens to their children? So by the end of April, I mean, they were also part of this list of essential workers, but at the beginning they were not, and one could see how quickly and how easily this is being overlooked, how essential a part actually practitioners play within the whole system. So I thought this was quite interesting, but I'm also glad and happy that they redressed this situation when they realized, oh, we made a huge mistake. But it's so easy to overlook. Yeah, the practitioners in ECEC. So easy, yeah.
That's indeed, I think, the interesting finding. One of the interesting things that comes out from this pandemic is how easily, indeed, things can be overlooked. I mean, in Italy, for example, it happened something similar. The 0 to 3 sector was not even mentioned and taken into account in the first guidelines, ministerial guideline for reopening. They forgot. And then they were at the end taken into account, but it's interesting that at the beginning they were kind of not. So it really gives a very clear image of the position of ECEC in social debate, in policy debates. And okay, then indeed at the end they did pay attention, but it was a process. And you see also, as I was saying, a diverse appreciation for diverse stuff in certain countries and regions. And again, there is a difference between split and integrated systems. In Belgium, you see a different appreciation given to, I said, childcare, but also out of school care stuff, which is in Belgium, it has a very important role, let's say, also in the daily life of children in preschool. So the out of school care stuff has to work with the same children and families that are in the preschools, but they are much less valued. They feel less valued. The same in Croatia, we see between educators and professional associates. Victoria, maybe you want to explain?
Thank you, Nima. I will just shortly add one more thing regarding the appreciation. There actually is a bright example from Croatia. The organization Active Voices of Health Workers was actually contacted by the Croatian Institute of Public Health when they were actually making the recommendations for working during the pandemics, which is a good example. But in general, I would say that everyone felt undervalued and unfortunately underpaid. And the thing that you mentioned, Nima, regarding the educators and the professional associates, is that something very interesting happened here. So there was a kind of a discord between the two groups, because the professional associates, so the pedagogues, the speech therapists, the behavioral analysts, they actually were advised to visit preschool classrooms only for a limited amount of time. So it was like about 15 minutes or so, which is a very, very short amount of time if you want to monitor the child's development and offer support to the educators and the children, because they would be in contact with a lot of different children from different preschool classrooms, and that's the measure for preventing the COVID-19 infection. But what was the end result is that the professional associates were perceived as those who were just sitting in their offices and waiting for the pandemic to stop. And the educators actually felt a burden of balancing between the protection of the health and between maintaining the process quality, but without adequate support of the multi-professional team.
Okay, thank you very much, Victoria. And I think what is interesting is indeed what I was saying before, that these differences in perception are not really there when the system is integrated. So when you have a 0 to 6 established integrated system, like in Germany and Sweden, you don't feel this this difference in valuing the different stuff. What are the challenges and the opportunities concerning workforce? We saw a very important role for the leaders, the directors, the coordinators. They were essential in, let's say, adapting the pedagogical practice and the vision with the COVID measures. So they have to be updated with the COVID measures and have the capability of creating this flexibility where you don't lose the pedagogical values, but you can kind of see how they can be integrated with the new measures, which was a challenge. But also a discovery in many cases. If you think about this was something we saw in the part related to curriculum, but if you see how, for example, the outdoor spaces were valued, how in many services they worked more in small groups, how the relationship with the families, although in a physical distance, in many services they kind of tried to create a connection anyhow, online, offline, outside, with pedagogical documentation. So all these things were challenging, but at the same time also an opportunity, of course. And especially the opportunity, I think it was the change of, let's say, the aha, which means the discovery of new possible ways of doing things that put in crisis, that taken into account concepts, but in a positive way, like, how can we do things differently, but still keeping our pedagogical values. Then another important aspect is the staff shortage that we saw in almost all countries, which of course also has a consequence in the lack of time to plan and reflect. So planning and reflecting is very important always, in crisis times also. But of course, if you don't have staff, this becomes complicated. And here we have an interesting example from Germany. And I give the floor to Henriette.
Yeah, thank you, Nima. Yes, I mean, staff shortage was really, I mean, it's generally an issue also, I mean, not considering the pandemic. But of course, within the situation of the pandemic, about 25 to 30% of childcare workers had a health certificate that said, you know, they belong to an at-risk group and therefore they cannot work. So of course, this was somehow, some cases balanced because there were also fewer children within the system. But already in June, what is very interesting, in June 2020, so 3 months, let's say, into the pandemic, the regional ministry here issued one of their circulars, and it says, I mean, the centers are allowed to hire what they termed unqualified staff. And then they gave also an explanation of whom they mean by unqualified staff. So it could be parents, it could be other family members, it could be volunteers from the national volunteer programs. It could be students who studied pedagogy or studied to become an educator. Or it could be volunteers that work with other youth groups, you know, in sports, in music, or the like. And I mean, it was very interesting that it was the first time that actually this group of people were actually given, let's say, state permission, regional permission to work in a childcare center. I have been trying to actually find data on how much this was taken up, but actually I couldn't find any data. So the information I have is only anecdotal from some centers who said, yes, we had for like 1 month, we had 2 parents coming regular helping us out. And the staff shortage, to come back to the point also that Nima made, that there was a consequence, that there was lack of time for planning, for reflecting, also for documenting, because an essential part, an important part of the educator's work is also documenting what the daily life in the center, the progress of individual children, and so on. And for this part, so the work not directly with children in Berlin, 25% of a worker's time, of an educator's time, is actually reserved for that. And that within that time of really making ends meet, that has hardly been possible to keep to that. With, of course, also then effects on the quality of the pedagogy and so on. And within considering that it was also a quickly changing actually environment, as Nima explained, that the groups had to be smaller, outdoors was much more used, and so on and so forth. So back to Nima.
Thank you very much, Henriette. That's indeed that's one of the common challenges that we pointed out in the report. And another thing that comes out concerning workforce is how the well, everything went on online, let's say, and what was the role of this online support, of the online trainings. Also, it was, we see on one hand a challenge, of course, because you don't have the face-to-face contact, but, and we see an example in Croatia, also an opportunity. So maybe, Victoria, you can explain why.
Thank you, Nima, once again. Regarding online support, of course, to use it, the necessary precondition is that you adapt quickly to the information and communication technology. So for those who accepted it for the workforce, and for those kindergartens where it became a part of the culture, it was of course a lot easier. They actually reported, for example, some southern parts of Croatia felt that they had greater opportunities to participate in continuous professional development activities, because up till that point, the trainings were held in bigger Croatian cities, and by actually transferring it online, they gained the opportunity to participate in it. So that's one good example from Croatia.
Yeah, so it created a kind of accessibility, let's say, for staff. But of course, on the other hand, you miss the face-to-face.
Yeah, a lot of adjustments had to be made. I'm talking now from the perspective of Open Academy step by step and the trainings that we were doing. So it had to be kind of comprised, shorter, with more breaks, and everything, how Zoom has affected us. So.
And another thing, Victoria, is also, well, here we point out that of course you need enough staff, but you also need to pay the staff, which seems basic, but it didn't happen always. So if you want to keep on giving quality, you need salary continuity for the staff. And in Croatia, you wanted to point out an example.
Yeah. It is important because I was talking about the accessibility and about the smaller fees paid by the families, but the question is what's happening with the workforce then, because the local budget wasn't strong enough and prepared for it. So unfortunately, it resulted in actually no wages or decreased wages of the workforce. And since there was a staff shortage, they had to work overtime, so they felt constantly underpaid. And actually, the biggest problem is that it was different from one community to the other, because the founder of most of the kindergartens in Croatia is the local government unit. So it was very different. For example, if you look at the sick leave of the workforce, in some places they were paid 85% of their salary, of their usual salary, but in some other places it was less. So that led to advocating for greater continuity, and not only continuity, but for equality. And a great issue has arose, and we realized that it really was necessary to somehow make the process more centralized in a way where actually the Republic of Croatia would either provide more funds to the local government units, or would prioritize ECEC and then insist on doing it on the local policy level as well.
Yeah, thank you. In other countries, you see that this salary continuity is there. For example, also in Belgium, of course in Sweden, in Italy, but there is also in some cases a difference between private and public sector. Of course, the private sector has had more difficulties in maintaining the financial, maintaining the ECC centers financially. Okay, thank you. And also here, I would give to the audience a minute to, if you have extra questions, things you want to write in the chat for later. But maybe I also quickly go on because I see the time. Give you some seconds. In the meantime, I start the last area that we want to share with you. It's governance and funding, which is of course also a very important one in this crisis and beyond. What we see from our report is that in crisis times, you need collaboration. I mean, you need collaboration always, but in crisis time, you need it very much. So we see a difference between fragmented and collaborative governmental systems. At the end, what we see is that, in fact, if we want to give a general comment, is that integrated systems again, kind of work better, like they can deal more easily with a crisis and maybe beyond a crisis. But if there is no integrated system, so 0 to 6, also collaboration, good collaboration is an important aspect to take into account. So if you have a good collaboration, this works as well. And what does it mean? It means the interplay between different levels of governance. So the collaboration between national, regional, local government is crucial. You see, for example, a lot of alignment in Sweden. It's just easier to deal with it. In some countries where you see, for example, in Italy and in Belgium, in Flanders, where you have the split system, there is a fragmentation sometimes between care and education policy domains. So this also creates, let's say, incoherent practice. To give a very concrete example, in Belgium, I was mentioning the out-of-school care and the preschool. They work actually in the same building often and with the same children and families, but they have different regulations and and also different pedagogical vision. They different, for example, child-free hours. They don't really meet to reflect together on the families and children that they are working with. So so of course, within the crisis, this just exploded and came out very clearly. For example, the measures taken for the out-of-school care were different than the ones taken for the preschool, but the children were the same. So half an hour before they couldn't play together, and half an hour later they could. So we had a lot of these unclear, let's say, moments in which it was not clear what the staff had to do. And this just brought up also on a policy level the urgency to deal with these themes. So we see it as a positive thing, let's say. So now we can more clearly raise our voice. Then we see the fragmentation between ECEC, health and social work policy domains, which can hinder the possibility to support especially more vulnerable families in crisis time. So that's also an important collaboration that has to be there, ECEC, health and social work. And what is important is also to have clear governmental crisis communication. This also makes a difference. Which means having clear guidelines with flexible possibility of adaptations. If you have a fragmented system, it's more difficult to have clear guidelines. You can have one guideline from one sector, one guideline from another one. And it's very important to have it clear and to communicate it in a clear way to ECEC, to the families. In Sweden and in Berlin, again, with an integrated system, this worked better, let's say. I don't know, Henriette, you wanted to say something about this, or it's...
Yes, I mean, in Berlin, actually, we have seen between March and December 2020, the regional ministry here issued 20 circulars. And in many cases, the circulars were like split circulars. There was one part of the circular was for the ECEC staff, and the other part was for the parents. So there was kind of this two-way communication with the professionals and with the parents. And this actually, although it also led to frictions, because sometimes these circulars came only out on Friday, and by Monday, these new the new policies should be in place, but it was really, really good that also parents, families were considered important to communicate with during the pandemic, and it was really it really smoothed things to a large extent. Of course, we don't know what would have happened if we didn't have this communication, but it was very much appreciated that there was so clear and really also tight communication with the actors involved. Over to you, Nina.
Yeah, okay, thank you very much, Henrietta, for this clarification. And again, if you have now questions about this, the governance and funding part, please put it in the chat. And we go towards a conclusion and then to the policy recommendation quickly. But what we can see from this analysis is basically that ECEC actually had a crucial role in countering the negative effects of the pandemic on children, families, and communities, and again with its educational, social, and economic functions. But compared to other levels of education, it was often forgotten. So it was actually one of the most vulnerable sectors, which shows the need to raise the profile of ECEC in education and care sector policies, and to address the gaps in access. And having this in mind, we drew specific policy recommendations, policy guidelines, actually, we call them, because recommendations looked a little bit too close, let's say. But we are not going again to explore all the policy recommendations, but just the ones concerning the 3 areas that we saw with you now. Concerning accessibility, what we say is that, especially in times of crisis, accessibility to high quality ECEC provision guarantees all children's right to education, well-being, socialization, and play. So again, raising the profile of ECEC in times of crisis and beyond. Then importance of striving for inclusiveness of provision. And efforts should be made towards ensuring that ECEC remains available, accessible, and affordable for vulnerable groups. Also, the importance of outreaching practice. So not just opening is not enough. You have to see it for who you're opening and who you're reaching. Then adequate digital equipment and in-person home visits are crucial tools to have communication with children and families who are not attending ECEC centers. Another important aspect is the transitions, as we saw, warm and welcoming transitions, and how you can guarantee them also within the measures and the regulations, so not to be forgotten. And sometimes in some ECEC centers, for example, they eliminated the familiarization moments, but this is not a solution. We have to see how to maintain them within the regulations. Then concerning workforce, structural measures addressing ECEC workforce shortage should be considered also beyond the crisis, because also one of the things that come out is that actually you cannot address much within a crisis. It has to be a work that happens already before on quality. And then if you have this work done, then you can also face the crisis in a more efficient way. Given the importance of always maintaining contacts with children and families, the importance of salary continuity also is addressed, as we said. The fact that pedagogical coaching, collegial reflectivity, and planning cannot be stopped during a crisis, so it has to be continued. And this is also linked to, of course, salary continuity and staff shortage. Then staff conditions and concerns have to be acknowledged. They cannot be forgotten. And here we also make a link to the possibility of including ECEC staff among priority groups for vaccination. Also in consideration of the fact that they don't work just with children, but they work also with families, and that's not just an appendix of their work. Then ECEC, the importance of ECEC leaders and directors. So it is crucial that an adequate decision-making infrastructure is in place at the level of each institution, and that there are opportunities for peer learning initiatives. Concerning governance and funding, as we said, we need a clear communication flow between national, regional, local authorities. A balance between centralized processes of policy regulation and decentralized implementation. So also this clear intention, but also the flexibility. Clear crisis communication with families and ECEC sector, so not contradictive messages. Interinstitutional communication protocols between, as we said, ECEC, healthcare and welfare services that should collaborate. And then we see that fragmented and underfinanced ECEC systems required higher support levels in pandemic times, also financially. So investing in structural, well-financed ECEC helps in facing crisis in a more efficient way. These are the main points that we made, the main guidelines that we drew concerning these areas. If you have questions, please write them down. And we also have 3 specific questions for you, but now I'm looking to my colleagues. Shall we first answer to the questions and then go, first answer to the questions in the chat and then go to our questions?
Mm-hmm. Yes, thank you very much, Nima. This was
thank you.
Thank you to well, really keeping it also. I know there is a lot of information in this report, and it was always not easy also to balance the different types of information. Sometimes they were almost like contradictory. So this is, I think, a very good gist of what is in the report. And we also decided to give you the possible policy guidelines that follow from this report, because we think, you know, this is something that you can maybe also use then in your countries, in your context, to actually advocate for better funded services, better staff services, and so on and so forth. Well, we have among the attendees of today's session also Aisha Ayali. Aisha Ayali joined actually ISSA this fall as a junior program manager. But Aisha was last year affiliated with actually doing this report. She was working alongside the colleagues in Belgium, in Ghent, of organizing the information and so on. So Aisha is one of the people who knows the report really very, very well. So Aisha, just to give you also the floor, because many of, or hardly anybody from the ISSA network actually know you, and please, what I wanted to ask you, you know, what do you consider the most important insights from your point of view when you were working on this report?
Yeah, thank you, Anierete. Thank you, Nima and Victoria. It was, I have to say that it was a great pleasure, and it was working with a great team and contacting countries, also in the middle of the problems of COVID. And for me, it was really an eye-opener to see the different perspectives on different approaches from different countries. Also, but to give you an overview about myself, I'm Aisha. I just joined ISSA this August, really new as junior program manager. But before, I was working, I was doing research, but also I was working on quality and workforce in different projects, including VPGK. I was very, very honored to work with the team. During the process of this report, what struck me as really important is that it all comes to having crisis or not. I think it all comes to having competent systems to begin with. So that's also Nima was also highlighting the integration and highlighting the cooperation between different sectors, so that we would have more space for innovative solutions when a crisis attacks. I also think that workforce becoming frontline workers and regarded as essential workers, it will elevate the importance of ECD and I think, well, they always say turn crisis into an advantage. In that sense, we could really elevate the importance of ECD and advocate the position in the whole society's functioning. So with this idea, I was always both amazed about the solutions, also the competent practitioners finding solutions. And maybe we didn't talk about it here, but one of the things that also strike me is about the curriculum and how to keep warm pedagogy and how to keep the balance between hygiene measures, changing environments, and still keep the child-centeredness and warm pedagogies, and making sure that children stay resilient and share their, maybe their home situations at home, and this creating this community feeling. And but I also see that it is a tough job for us. We have to work a lot to align all of those, and I can see that when the workforce is competent, the system is competent, and when we have good networks, we would be in a better position to deal with next crisis. Hopefully not to come, but we're now more prepared, and we can prepare for if we know now the tools to advocate, to prepare for these kind of things and elevate the importance of ECD. Yeah. And thank you again for these reports. I hope everybody from different countries, I hope we can hear from them as well. I'm really wondering the reflections also about the participants, and I'm excited to hear the opinions also. Thank you so much.
Okay, thank you, Aisha, for your insights. Yeah, before we share the questions with you, maybe one thing we haven't really talked about is this report was actually financed by the European Commission, and actually what should happen now with this report, or what is, and there was also a webinar presenting the report in early October at the level of the Commission, is that they would use this report and the guidelines that were formulated to actually draw up some funding programs in order to help the sector to address some of the results that the report has shown. So it's not just a report for the shelves, but is a report now that serves as the backdrop to actually then come to a level where funding is being made available on the level of the EU, and then actually for structures within all European Union countries, and also so-called third countries, of course, can also benefit from that. So there is the effects and the results and the benefits of this program do not just rest with having written it. It will continue. So yeah, so we'll maybe Olesya will share we have prepared 3 questions of you that we found relevant to engage in an exchange and in a discussion with you, because I mean all of us have been touched by this situation. There's none of us whose life has not been has not had any impact on that. So I mean, of course, you can share beyond the questions, but the questions we thought relevant now for this discussion was, what were the main rationales in your country to open and close the ECEC centers? And then we had the guidelines, well, stroke recommendation. Which of these recommendations do you think are particularly important in your country or in your context? And a question that maybe goes more to those who are trainers, who are practitioners, ECE staff. How was professional support organized in your country during the pandemic? So we'll now put on, I don't know, the gallery view so that we can see many of you, but also keep the questions so you can sort of link to the questions, and we look forward to your comments. I think you have been silent for quite a long time, patient and silent for quite a long time. So So who would please raise your hand? You know, there's this device on the bottom of your screen. Yes, there's Chiara Piccolo. So Chiara, I give you the floor.
Yes, I was switch on my mic. Yes, I'm Chiara Piccolo from Learning for Wellbeing. And yes, I have few questions actually. One is about accessibility and how this report that you presented today can be useful in order to support the national action plan for the child guarantee, because probably you are aware that there is this funding scheme from the European Commission just let's say just launched, I mean, on March, and now it's basically to support country, to advocate, to suggest to the countries, and for some countries they are obliged to use those funds to make also the ECEC more accessible, especially for disadvantaged children. So how this can report be useful to advocate for that. And regarding the other questions that I see, I mean, I can reply having two different hats, let's say, as a professional that work in as, let's say, EU policy advisor here in Belgium, and as mom who face difficulties in dealing with work and children, and faces also all the problems that school of my kids had during the pandemic. And also just a few weeks ago that there was a cluster in the school of my kids, so they were again at home. So first of all, yes, it's use what can suggest it's using those funds that the European Commission already have devoted to this issue, to accessibility, and about the organization, the professional. I mean, I can answer also from, I'm Italian, so I have contact with friends that are teachers in Italy. And one of the main problems that they faced was trying to reach children who has no access to IT devices. And so all the tools and the learning activities made through distance learning were only for a few people, because other, especially those disadvantaged, had no access on this. Mm-hmm. And finally, so on that side, of professional side, it's also a lack of training and preparation to face this transition to frontal and in present, let's say, learning and digital one. And also here in Belgium and in the school of my kids last week, I mean, we face problem because also teachers are not really friendly with the teams and all the other stuff. So this is my suggestion.
Thank you, Chiara, for your comments. And let me turn to the first question that you had: in which ways, you know, this report can also help with accessibility, with increasing accessibility, also in the framework of this new child guarantee initiative that was launched by the EU. Nima, do you have some, because on the child guarantee, I'm not an expert. Maybe you, Nima, you can say a few things on that, or maybe
no, I was just thinking it is indeed, we link it to many parts of the report, especially the part connected to accessibility. But I was just thinking that I think the policy guidelines that we give concerning accessibility, these are very much in line with what comes out from the child guarantee. So this is what I would use. It is also interesting that actually how to reach the ones that are not there is not really thought very much in many countries. We have some examples, I said, especially in Germany and in Belgium. And at the end of each chapter, besides the policy guidelines, we also at the end of each chapter in the report give some very concrete examples. For example, what it means outreaching, how do you do this with the words of the teachers themselves. And maybe this is also something that that can be used in a very concrete way to do policy advocacy and to influence policy, both policy and practice, I think. So that's what I would say.
Has somebody else in the audience also insights into this child guarantee policy? Because I haven't looked at it until now, so I can't say much to that. Okay. Okay, seems nobody. But coming actually to your point about digital devices and so on, what we have seen is actually that the parents are usually much more savvy on digital devices, and a lot of parent meetings or meetings with parents, individual and as a group, have actually been organized via digital devices. I mean, since we deal with an age group younger than 6, there is a lot of discussion at the moment about digital education for this age group, and we are just in the process of actually, as a society also and as a group of professionals, finding out, you know, what is really adequate for children of this age. And of course, what you mentioned is more school, and that there is a big impediment that many families have maybe only one computer at home, and the internet connection is not very good, and it's basically, you know, it excludes children from education, and of course, I mean, this is not good. This is something we need to tackle, all of us as societies, and I can tell you that also Germany there has a lot of ground to still to cover. Okay, thank you, Chiara. So I'm going to see. Okay. So who else wants to share some of their thoughts around what happened in their context during the pandemic? Maybe not only in 2020, because as I said before, the report was basically for the month in 2020, but of course there's in each country again a new situation, and we still oscillate between in some countries between closing and opening, and somehow finding a way of keeping actually the structures open. So also around this, I think, would be very interesting to talk about. So whom of you is there to share? Okay, particularly I think it's what is interesting also, we touched upon this quite a bit, is how professional support was actually organized within the country, because we can on the one hand see that that there were of course need really for children and parents to attend the service, but then we cannot overlook really the needs also of the staff in the center, and they have health concerns, they have their own family issues, their children to look after, schools were closed for a long time, so what to do with the older children and so on. And I think within that kind of very stressful environment and very stressful situation, it is very important actually to organize this type of professional support. I mean, my colleague Stepanka Buzulianu has shared in the chat that actually rate of people who still report sick, and who report sick not because they were infected with COVID, but because these were so stressful times, and it led in some cases really to burnout, and they are actually still they are still on sick leave. I mean, in order to avoid these situations and that they are not recreating themselves, I think this professional support is really, really important. So do others that have listened now to what we had to say, do you have some comments? Because maybe some of your organizations were also involved in providing this kind of additional support to professionals in this situation. Please raise your hands if you want to, so that we can unmute you. Yes, Ashken, I see you, Ashken.
Hi.
From Armenia. Hi, Ashken.
Great to see everybody.
Yeah, great to see you, Ashken.
During, I think this year already, not the time of your report, we provided professional assistance to preschool educators within two of our projects. One was with World Bank and another with UNICEF, and we were organizing online and within UNICEF project already normal trainings, giving the educators the content, thematic units on hygiene, COVID prevention, how to teach children basic hygiene rules, how to cope with all fears, and understand their role as people who also can prevent have preventive role in this situation. And we collected a lot of information about the situation in kindergartens when they were on lockdown and then reopening, and understood that it was generally very stressful situation for everybody, because they were so much worried about keeping all hygiene rules in kindergartens. They were so much afraid of being checked and punished of not keeping those rules. They had a lot of difficulties with adjusting those rules to their situation on the ground. For example, keeping distance between children during in the center of 1.5 meters was almost impossible, because they didn't know how to organize games, group works, how to do everything. Children were literally during first several months they were sitting on the chairs with their individual games. All games were clean, separated into individual boxes with the names of children. So they will play, and then at the end of the day, the games will be disinfected. So a lot of materials were taken out of the classrooms, rugs, soft corners, that kind of things. But generally during the work they understood that it is not possible to keep children in separate areas whole day. Anyway, they eat with each other, they go to the same toilet, and I mean they still have some connections, and that was very stressful for everyone. During the work, they understood that they can do that, but they need to think about the quality of education they are providing, but because quality went down dramatically in this case. And our trainings help them to understand how to organize at least group works in a way that they are not so close, but still they have they work in pairs, they can talk to each other, they can pass each other the materials, then they can disinfect it. And I think that the professional development events are very important during this period, because people can talk to each other, can understand if something that they are doing is common to others, and is it right or wrong? Do others have the same difficulties, and how they can overcome those difficulties? You talked about a lot of examples from different countries, and we went through the same. Lack of digital devices, parents meeting during within Viber groups or on other media ways, and of course that cannot last for long period. It can be for short period, but still people need to see each other. They should use the opportunities that they have. And for example, we have long springs, hot summers, and good autumns. So we decided and advised to do a lot of parental meetings and that kind of events outside of kindergarten, in open area when it is possible, to reorganize the open area, allowing people to sit there, to work and to have connections, because online meetings cannot last forever, and not everybody is participating on those meetings, though young teachers can sustain that for a period of time. We also have a lot of debates now in the country about media and children of that age, security, and whether it is necessary to involve them so much in education through media, because we see that social interactions are important. And as soon as the kindergarten were opened and the quantity of children were brought to normal, all families wanted to send their children, because children need to work with each other, to play with each other, and it is not possible to do at home. I think that difficulties are common in all countries, and we need to be flexible and understand that rules are rules, but we need to adjust our environment in order to involve parents and to work with them and to help them with materials. We also did very good parental education, small program for villages, where people also, they were affected by war, they were locked down, and we had parental education project with them, so gave materials to teachers, and they were sending materials home and working with parents on online way, so parents could work with their children while the kindergartens were completely closed during that period. It was before last winter. That's it. Thank you.
Yeah, well, thank you, Ashken. I think this points really what you said about the pedagogical practice. I mean, we haven't talked about curriculum and pedagogy so far, but a large part in the report is actually around curriculum and pedagogy. But we haven't, in the 5 countries, Nima, maybe you can say a bit more about this, not come across really situations that you describe, you know, where the rules for the adults were also transferred to the ECEC centers, you know, the thing about 1.5 meters of distance, about masks and so on. So this is really something that, I mean, we all know how ECEC centers function and how children, you know, want to be close, want to be interactive, that this can't work. So Nima, maybe you can also.
Yeah, no, for ECEC, indeed, especially the 1.5 meter and the mask and these kind of things are not applied. In countries like Italy, they are applied from 6 years old. But I just, while Ashken was talking, I just wanted to give a small, another small insight, if I can, because you stimulated my reflection. When you were talking about the materials that you had to take out from the children's room, I just had in mind an interesting example, especially from Croatia. Victoria, you can confirm that how things can have 2 sides, because we see, for example, of course, if you take away materials, you cannot use them and you have to wash them, and it creates an effect on the autonomy and on the active involvement of children, which is less free, let's say. But on the other hand, what was interesting and comes from the Croatian report is that taking out materials stimulated in some quality ECEC centers a reflection about less can be more pedagogy. So, which is also something that is very present in some Italian regions. But how can you not overstimulate the environment, but actually create calm places in which children can discover, so you don't need a lot of materials, but you need well-chosen materials. Of course, in this case, you're kind of obliged to eliminate some materials, but the reflection behind it was interesting. So how from challenging situations, actually something also positive can come out from, as you were also mentioning, at the outdoor spaces and how to create a relationship with families. So yeah, how the challenges can become opportunities. I think that's one of the main lessons learned from mainly on a pedagogical level from this crisis.
Yeah. Thank you, Nima. Victoria, would you like to add something? Then we have to unmute you because your mic is out.
Thank you. Yeah, actually, it was very interesting listening to Ashken, because it's like you told the creation story about implementation of the curriculum during the COVID. So it is very similar in our case as well, and I'm happy that you brought to light those issues regarding the implementation of the curricula a bit more, but also at the same time mentioning the workforce and all the stress they've been going through during the second wave. In our case, it has become evident that by gaining more knowledge on the pandemics, the educators became more autonomous in making decisions on how to balance the safety measures and the quality. So they were relieved in a way, but if you look at it, it was also a decision they had to make on their own. So it's actually a heavy burden to carry, but they became a bit more relieved. And what I wanted to point out regarding the support to their professional development, I think that non-governmental organizations had a huge role during that period, as you were mentioning. And one more thing is that they started to actually establish different initiatives, the educators, for advocating the rights of the workforce. So that was an interesting trend to observe during the pandemics.
Mm-hmm. Thank you, Victoria. We have a comment actually by Tamta Kukashvili. I hope I have pronounced your last name sort of understandable. Tamta, you saying that, so please, for you who are still online, go to her contribution in the chat. I mean, she's saying that ECEC is not a priority for the Georgian government. She's from Georgia, and this has actually also led to the ECEC centers being the first that closed and the last to open. And I'm sure you will find in the report really rich argumentation of why this should be really changed. And if the Georgian parents stood up and would say, hey, but we need the service because it allows us to be active members in the workforce and to be and for our children actually to thrive and not to be just cared at home. I think that would, I hope that you can use the report also to make, maybe not at the national level, but certainly at the local level, policymakers and those deciding on opening and closing services more aware of how important these services are for the whole functioning of society. So I'm very sorry to hear that that in your country, you know, this is not a priority at all. We still have to grind a lot of corn in order to have this sink in all the countries, how important ECEC is. So actually, I'm seeing that more and more people have actually also left our call. Well, it's the third within for this week, and I also very well can understand that people have to tend to other to their work and to their colleagues. And we have also heard that a couple of participants had to leave because they were actually called by colleagues and they had to tend to some emergencies. Well, I would like to give, well, thank you all, and thank you, Nima and Victoria in particular for sharing your insights and for presenting this very rich report. I would like to hand over to Liana and give her the opportunity to close this ISSA Connects week for learning and greet the audience that is still here. Liana, over to you.
Thank you, Henriette, and thank you to Nima, to Victoria, to colleagues from both organizations, VBGK and Open Academy, Step by Step. Yes, like Henriette said, this week we had 3 sessions, and we were delighted for all 3 of them to partner with either with board members or with ISSA members. So actually we wanted this event to feature the knowledge that we have in the network. And yes, it's true that not so many colleagues could join for the live sessions, but at the same time, we know that many will come and watch the recording. So hopefully the knowledge you shared will be useful and inspiring to more. We will continue to tap into the knowledge of our members and their experience, and also as a network to create such opportunities that we learn from each other and share experiences that hopefully can help each of us have a stronger impact on behalf of children and young families. So from my end also, a warm thank you to all of you who participated, those who shared, and also a warm thank you to colleagues from the communications team that have been for the whole 3 sessions actually helping with all the technical aspects. So a wonderful collaboration. A big thank you to Henriette that you helped us with 2 sessions, the first and the last, and really grateful for your leadership as ISSA's president and everything you contribute. And in terms of what comes next, we will of course share the recording, and we will share other links that are useful related to these sessions. And also we have, by the way, on the ISSA website soon a section of all the recordings of our past online events. And in terms of what comes next for our network, we will meet again at the end of the month on the 23rd and 24th of November, when we have what we call ISSA Connects for Community. This was ISSA Connects for Learning, and later in the month, we will connect for community, where we will have a council meeting, but also a special community strengthening session. And we're working hard now to make that interesting for you, a platform for sharing. So please join. We hope that more colleagues will join. And we are also offering translation into Russian. So we're really excited to continue to make sure that our network is resilient. Yesterday, we talked a lot about organizational resilience that also starts with personal resilience. And a factor for resilience is our connectedness. So we hope that the network we as a network can support each and every member of the network to be more resilient and more successful in what they do. So yes, a reminder from Teresa that we also invite you to share, to sign up for our newsletter if you're not already signed up. Follow us on social media and you will be always up to date with what is on offer and also what our members are doing. So thank you, and hope to see you all at the community event, and a big thank you to those who shared and their hard work for putting this session together. Have a good rest of the day and a nice evening for Ashken and other colleagues who are later in Georgia also, and see you later this month. Stay well, stay healthy, stay resilient, stay connected.
Bye-bye, everybody.
Bye-bye. Thank you. Thank you, Liane, and thank you all the colleagues.
Thank you. Bye-bye.
Bye-bye.